The arrival of COVID-19 has put the spotlight on the use of telemedicine as an option to administer healthcare. Telemedicine refers to the delivery of healthcare services using information and communication technology to connect a healthcare service provider with a patient where distance is a defining factor. To talk to me about the importance of telemedicine during the COVID-19 pandemic is health economist Tuyeni Peter. Rose, good evening and thanks for joining us on the program this evening. Well, telemedicine isn't new, but the COVID-19 pandemic has really put the technology front and center. Talk to us through how this type of medical care is effective.
Thank you for having me. So the importance of telemedicine, specifically now in the time of COVID-19, is that it allows people to remain in contact with the healthcare system without putting themselves at risk. And outside of this COVID-19 context, it also allows people who wouldn't normally have access to healthcare services, perhaps because they live too far away or perhaps because they can't afford them, to access healthcare services and high quality healthcare services at that.
Let's track back a bit. I mean, even when doctors' offices were open, some patients avoided in-person appointments due to the COVID-19 fears. Is this still considered a safer means to seek medical attention?
Yes, of course, it is still considered safe. And of course, not all conditions lend themselves to teleconsultations, but many of them do. And it helps us to decongest our health facilities. It also helps us to protect our healthcare professionals. And it also helps to protect people who have chronic conditions from being exposed.
So besides giving telemedicine a boost, the pandemic has also fostered the rise of innovative medical services across the world. Everything from getting prescriptions by mail to drive through virus testing and pharmacy-based vaccinations. Is it likely that many of these kind of innovation approaches to healthcare systems are likely to linger long after the pandemic subsides?
I think they are likely to do that. And I think because people have had the experience of the convenience of using these healthcare services, it's entirely possible that people will continue to demand these services. But if the regulation also remains as relaxed as it is, it will also enable increased innovation in this space as well.
So in terms of the practical use of telemedicine, just for the layman person, just take us through how it works.
So telemedicine can be administered in many different ways. One of the ways in which you've described already is that you can have a doctor who is consulting with a patient remotely, or you can have a doctor who monitors their patients remotely using wearable devices, or you can have what we call asynchronous communication between doctors and patients, where information about patients' conditions is delivered not necessarily in real time, but later and processed and fed back to the patient later on after being interpreted by doctors. So the fact that telemedicine uses technology means that there are pretty much as many ways as tech available that healthcare can be delivered to people. And depending on the different conditions or use cases, there are many innovations that are possible as well.
In South Africa, are we finding that telemedicine is becoming more popular?
So our study has found that the usage of telemedicine has definitely gone up since the COVID-19 pandemic, because firstly, there is a use case, and also there has been an increase in innovation in this space. Previously, telemedicine in South Africa was pretty strictly regulated, and first-time consultations between doctors and patients were not allowed by the regulator. But to protect healthcare workers and to maintain contact with the healthcare system, the regulator, in this case the HPCSA, has relaxed the regulation and allowed for first-time consultations between doctors and patients. And this has, in some ways, increased the usage of telemedicine services, but massively increased innovation in this space as well.
I actually want us to expand into that aspect of regulation. Now, telemedicine in the context of COVID-19 has encountered two major regulatory hurdles. The first was that before telemedicine could be practiced, there had to be a face-to-face consultation with the patient. Now, these were according to ethical guidelines which are set by the Health Professionals Council of South Africa. Furthermore, a health practitioner could only practice telemedicine in an established practitioner-patient relationship existed between the two. Now, how do health practitioners overcome these regulatory hurdles?
Well, at the moment, as I've mentioned, the HPCSA has relaxed these guidelines to allow for first-time consultations. And this has really created a golden opportunity for us to collect evidence of the potential for telemedicine to be part of the continuum of care and providing healthcare. So at the moment, doctors are able to do first-time consultations with patients, and not only doctors, other types of healthcare providers too. And this relaxation has really allowed different modes of delivering healthcare to come into the market.
Okay, so telemedicine also gave physicians the ability to keep their practices, which might otherwise have been shuttered as a patient stayed home. Talk us through this aspect.
So because, as I mentioned before, doctors would have wanted to protect themselves from infection, and also patients who are high risk, who have high risks of complications due to COVID-19, would also have wanted to stay away from healthcare facilities. These telemedicine platforms have allowed doctors to remain in touch with their patients. With one provider that we spoke to, they have managed to do up to more than 10% of their consultations via telemedicine that wouldn't normally have happened if these regulations had not been relaxed. There are plenty of practitioners who are at high risk who have managed to protect themselves while maintaining their source of revenue because of telemedicine.
Now, before I let you go, I also want to speak about telemedicine in a South African context. What would you say is the importance of this kind of consultation, especially in rural areas?
So it definitely increases the access of healthcare to people who wouldn't normally access it at all, specifically access to specialist care. It also, in where it's provided in the private sector, potentially even allows to lower the costs of accessing private healthcare for those who are willing to pay some amount, but may not be able to actually pay the full private sector rates as well. It's also allowed us to innovate in different ways. COVID-19 has, in many ways, accelerated the development and innovation of telemedicine in the public sector. Certain things that were tried to be implemented decades ago and have laid dormant are now being implemented in the public sector. And there are so many gains that have been made. And it would be really wasteful of us to not maintain this momentum and maintain these learnings that we have gotten from COVID-19. And allowing the regulation to remain relaxed allows us to also collect more evidence of impact for telemedicine as well.
But would this kind of practice just be limited to a doctor just or seeing or detecting my symptoms, or could I actually get the medicines prescribed to be sent to me as well? And still, I want to maintain this context of people being in rural areas.
Yes, there is definitely potential for all of that. And I think and with some of the providers that we've seen, they've allowed for the acute monitoring of patients outside of healthcare facilities so that they remain protected as well. So using wearable devices to monitor, the progress and the health of patients who would normally have remained admitted in hospital. So there are really many use cases for telemedicine. And the current regulatory environment and the use case created by COVID has given us an opportunity to observe how telemedicine can remain part of the continuum of care at different stages of care.
Well, Rose, thank you very much for that insightful chat. That was Rose Tuyeni Peter, a health economist at Percept, talking to us about telehealth care during COVID-19.